Bismillahirrahmanirrahim. Our topic for today is
Bartonella, a small pleomorphic gram-negative rod that is a very fastidious organism. That means that it will not grow on your normal culture. Instead, it will grow on a very special type of culture. Now, the causative organism that is involved is Bartonella hansleyi. Bartonella hansleyi is present in the oral flora of many cats. Now, as cats lick themselves, so there is more chances that this can be transmitted when upon scratches or bites from a cat. Another research also tells us that cats also consist of a specific type of fleas which carry this bacteria, which can be another mode of transmission to the human being as well. Now, it is a low virulence organism and the disease is mostly self-limiting unless the patient is immunocompromised. Clinical finding, the beta hansleyi develops two types of diseases, one being cat scratch and the other being bacillary angiomatosis. Now, cat scratch and bacillary angiomatosis depends upon the immune state of the human being. If the patient is immunocompetent, then the human being will develop cat scratch disease. Now, this is a self-limiting disease and it manifests as fever and tendon nodules typically on the site of the scratch. And along with that, what we can see is a papule at the site of scratch and along with lymphadenopathy on that same respective site. Now, no antibiotics are needed because this is a self-limiting disease, but we can give the patient azithromycin if there is severe lymphadenitis. Now, going towards bacillary angiomatosis, which occurs in the immunocompromised patients, such as those people who are having AIDS or immunodeficiency syndrome, which is immunodeficiency syndrome. Now, what happens on these are human beings is that a cherry red vascular lesion occurs on the skin as well as the visceral organs. The lesion also appears papillary or nodular. Bacillary peliosis is similar to bacillary angiomatosis except that in peliosis, the lesion primarily occurs on the liver or in the spleen. Diagnosis of cat scratch disease is basically done on serology because we have specific antibodies that react with beta hansleyi antigen and that can be easily detected. This organism is not grown on culture because it takes approximately 5 days and which is just too way long. So another thing which we help in diagnosis of bacillary angiomatosis is that we take a biopsy of the lesion and we grow it on Wharton silver starry strain. Now this helps us to diagnose or find the pleomorphic rods in the biopsy tissue. And another thing is that this is quite similar to Kaposi sarcoma. So what we do is we do a pathological examination in order to differentiate between these lesions. Cat scratch disease is that it is very self-limiting, so no antibiotics are needed. But in severe cases with severe lymphadenitis, we can give the patient azithromycin. This disease do not have any long-term complications, but in some cases, in very rare cases, it can infect the whole body, causing a systemic infection like it can involve the heart valves, causing endocarditis, and it can affect the brain, causing encephalitis, which is irritation of the meninges of the brain. Then what we do in bacillary angiomatosis is that we can give the patient doxycyclines or we can give the patient erythromycin.